Research models are only as good as their ability to emulate the natural environment. For many decades, ever since the isolation of the first cell lines, tissue culture incubators have been essential for in vitro models. Cell culturing and experimental modeling have led to many breakthroughs, translating into a profusion of life-saving therapies. However, experimental variability remains a critical issue, with numerous studies demonstrating an inability to recreate previously published results. While many explanations for the lack of reproducibility have been put forth, such as research reagents, authenticity of cell lines, poor laboratory practices, in addition to many others, there is one important factor that has been overlooked: the tissue culture environment. Since the 1960s, tissue culture has been performed under what is considered normoxic conditions at 21% oxygen. However, the reason a vast majority of peer-reviewed publications describe using 21% oxygen is not scientific but simple historic precedent. In fact, extensive evidence supports the conclusion that cells cultured under appropriate physiological conditions express in vivo regulator genes that are silent at normoxic concentrations, such as hypoxia-inducible factor. Malaria parasites, lymphocytes, embryos and stem cells, to name a few, all require physioxic environments for optimal cell function. Furthermore, the tumor microenvironment has long been known to be in a hypoxic state, dramatically influencing the behavior and function of tumor cells, stromal cells, and immune cells. It is only in the latter half of the 20th century that a few groundbreaking researchers began conducting in vitro experiments reflecting physiological levels of oxygen in situ, using accurate conditions at 0.1 to 10% O2. In 1973, Billups-Rothenberg Inc., BRI, founded by Jim Billups, an engineer from the Scripps Institution of Oceanography, and Dr. Barry Rothenberg, pioneered the development of low-cost tissue culture incubators, capable of providing a full range of O2, CO2 conditions, enabling various in vitro environments. Over 50 years later, these proven designs have become the gold standard for physioxic experiments. These tools are mainstays in fields such as stem cells, IVF, tumor biology, and malaria research in thousands of laboratories worldwide. These tools have been cited in thousands of peer-reviewed articles, including Nobel-prize award-winning work on HIF-1 alpha and the control of gene regulation by oxygen levels in animal cells. In 2021, BRI embarked on a new chapter when it was acquired by Embrient Inc., a newly established company with a mission to carry forward the far-reaching legacy of BRI products. Importantly, the entire BRI product line and management team remains intact, ensuring seamless continuity and dedication to serving the research community. Embrient looks forward to providing high-quality tissue culture incubators to address reproducibility issues in cell culture research.